What if the food you eat could turn back your body's inflammation clock? Not with pills or rules, but with a spoon. Japan's most respected doctor lived past 100 and saw patients until the very end. And what he ate daily is now confirmed by modern science to fight the very inflammation that slows us down after 60. One of these foods, it's sticky, it smells, but it could clean your arteries better than medication. After 60, inflammation doesn't always scream. It whispers through stiff knees, brain fog, slower mornings. Dr. Shigeaki Hinohara, Japan's beloved centenarian doctor, believed in food as quiet medicine. His daily habits, now backed by medical research, target these hidden fires. In this video, we'll walk through 5 foods he used to calm inflammation, support his heart, and keep moving. Well past 100. 1. Natto, the silent janitor for your blood. In Japan, they say, food is medicine if you eat it with intention. And for Dr. Shigeaki Hinohara, who practiced medicine until the age of 100 and lived to 105, few foods were more sacred than natto. Now, I know what you might be thinking. Natto, that stringy, sticky fermented soybean dish? Yes, the one with the strong smell and the gooey texture. But hidden inside this humble dish is one of the most powerful anti-inflammatory tools nature has given us after age 60. You see, natto contains an enzyme called nattokinase. It's your body's silent janitor. This enzyme breaks down fibrin, a protein that acts like microscopic glue inside your blood vessels. As we age, fibrin builds up, thickening our blood and clogging circulation like lint in a dryer vent. But nattokinase sweeps it clean. And that's just the beginning. Natto is also rich in soy isoflavones, plant compounds that gently mimic estrogen for women after menopause and even for men. These isoflavones help lower inflammatory signals like TNF-alpha and IL-6, which spike after 60 and are linked to joint pain, fatigue, and even cognitive decline. Finally, natto is fermented, meaning it's packed with living probiotics that restore aging gut bacteria and calm systemic inflammation. One clinical trial from 2023 showed that nattokinase improved blood pressure regulation in seniors. 66% of participants normalized their plasma renin levels, compared to just 8% in the placebo group. So, how can you use it? Start small. 2 tablespoons of fresh natto in the morning with rice or eggs. Or, if the taste is too strong, consider a 2000 FU nattokinase supplement. But always check with your doctor, especially if you're on blood thinners. Helen, 69, had stubborn blood pressure for years. Within 6 weeks of adding natto to her breakfast, her numbers dropped, and she finally felt steady again. She told me, "I never expected something so strange, to make me feel so clear." Sometimes healing wears a funny face. 2. Miso Soup, the healing broth that talks to your cells. There's something deeply comforting about a warm bowl of soup. But in Japan, especially for those over 60, miso soup isn't just comfort food. It's quiet medicine. Dr. Hinohara believed miso soup should be part of every senior's weekly rhythm, not just for the taste, but because miso actually speaks to your cells. Let me explain. Miso is made from fermented soybeans, and that fermentation process creates probiotics, which act like builders for your gut lining. After 60, our gut bacteria decline, leaving us more vulnerable to inflammation. But here's where miso gets fascinating. Those probiotics produce short-chain fatty acids, or SCFAs. These are chemical messengers that travel through your bloodstream and gently whisper to your immune system. Calm down. No need to attack. Let's repair instead. At the same time, soy isoflavones and miso act as natural AC inhibitors, helping relax blood vessels and ease tension in your cardiovascular system. This matters because after 60, our AC activity often increases, silently raising blood pressure and strain on the heart. A 2017 study in Japan followed over 500 seniors who consume miso soup regularly. Despite its sodium content, their heart rate dropped without raising blood pressure, thanks to this natural regulatory effect. So, how do you bring this into your life? Start with 1 cup of miso soup 3 to 5 times per week. Include traditional toppings like tofu, wakame seaweed, and scallions. Try it with lunch or dinner to help ease digestion and support nighttime blood flow. Frank, 72, didn't believe food could calm his nerves, but after adding miso soup to his dinners, his sleep improved, and the tension he carried in his chest softened. He said, "I didn't expect soup to feel like a reset button." Now, let me ask you gently, have you ever tried miso soup before? Or would you be open to it this week? Sometimes healing doesn't shout. It steams quietly, waiting for your spoon. 3. Tofu, the muscle-saving memory. Food for decades, protein meant meat. Beef, chicken, fish, and for many, that was the only way. But Dr. Hinohara saw things differently. In his home, protein came from the earth, not the butcher. And the food he returned to again and again? Tofu. Now, tofu isn't just a substitute for meat, it's a support beam for the aging body. Here's how. Tofu contains complete plant protein, which helps preserve lean muscle mass. After 60, our muscle fibers naturally shrink, a process called sarcopenia, making us feel weaker, slower, more fatigued after simple tasks. But soy protein doesn't just rebuild tissue. It also contains isoflavones, which are plant-based compounds that gently mimic estrogen. In both men and women, estrogen plays a role in regulating inflammation, brain cell communication, and even bone density. One major study from the American Journal of Clinical Nutrition found that seniors who consumed soy regularly had better bone density and slower cognitive decline compared to those who didn't. Why? Because soy isoflavones support something called BDNF, brain-derived neurotrophic factor, a protein that acts like fertilizer for brain cells. It helps neurons grow, connect, and protect themselves as we age. And here's the best part. Tofu is incredibly easy to use. Dr. Hinohara often ate half a cup of tofu stir-fried with bok choy, garlic, and sesame oil 2 or 3 times per week. That single dish offered clean protein, gut fiber, and cognitive protection, without the inflammation linked to red meats. Let me tell you about Rosa. She's 74, retired, and for years avoided tofu because she'd heard it messes with your hormones. But after watching a documentary about Japanese centenarians, she decided to try it. A few months later, she felt lighter, clearer, and, in her words, less foggy in the mornings. Sometimes what we avoid is exactly what we need most. And that brings us to something important. Because there's a myth about soy, especially for men, that needs to be cleared up. What most people believe is completely different from what the research says. Let's talk about it. Myth versus fact. The soy controversy. Feminizing men over 60. What most people believe is that soy is dangerous for men. You've probably heard it. It'll lower your testosterone, mess with your hormones, make you less of a man. But here's the truth. That claim, it's not backed by science. In fact, multiple meta-analyses, including one published in the Journal of Nutrition in 2022, found that soy isoflavones have no measurable effect on testosterone, libido, sperm count, or muscle mass in men, even at high doses. What they did find? Men who regularly consumed soy, particularly in traditional diets like Japan's, had a 7-fold lower risk of prostate cancer compared to men eating typical Western diets. Let that sink in for a moment. The very food people are afraid of, may be quietly protecting their prostate, their heart, and even their brain. Let me introduce Frank. He's 73, a retired firefighter, spent his whole life avoiding soy because of those headlines. But after watching a program on Japanese longevity, he tried a simple swap: tofu stir-fry instead of steak twice a week. 3 months in, he felt stronger. His cholesterol improved. His urologist even commented that his prostate levels were the best they'd been in years. Frank told me, "I didn't feel any weaker. If anything, I felt more balanced." Here's the bottom line. Soy doesn't feminize men. It nourishes aging bodies, male or female, in a way few foods can. So next time you see tofu on your plate, don't fear it. Understand it. Because fear makes us avoid the very things that can help us heal. 4. Seaweed, the mineral blanket for your cells. If tofu is the structure, then seaweed is the covering. In Dr. Hinohara's daily life, Seaweed wasn't a garnish, it was a foundation. A food he returned to again and again for its quiet strength, especially as the body ages. You see, seaweed, whether it's nori, wakame, or kombu, is more than just a salty wrap for sushi. It's one of nature's richest sources of iodine, magnesium, and polysaccharides, all of which help lower inflammation at the cellular level. Here's why that matters. After 60, the body's ability to regulate thyroid hormones begins to decline. Even a slight imbalance can trigger inflammatory cascades, especially in the joints, brain, and cardiovascular system. But seaweed feeds your thyroid, delivering the iodine it needs to keep hormones in balance, while magnesium acts like a cellular relaxant, helping lower stress-related inflammation. One 2020 study in the Journal of Nutrition and Metabolism found that older adults who ate seaweed 3 times a week had significantly lower C-reactive protein levels, a key marker of systemic inflammation, compared to those who didn't. But it's not just the minerals. Seaweed contains fucoidins, unique compounds found only in marine plants, which support the immune system and may protect blood vessels from oxidative damage. And the best part? You don't need much. Just 1 sheet of nori with lunch, or a tablespoon of wakame sprinkled into soup or salad, 3 times per week is enough to see benefits over time. Kenji, 76, grew up eating seaweed with rice, but had stopped for years. When he added it back in, he said something surprising. "My hands stopped getting cold, and I don't feel as inflamed." Like a soft blanket pulled over sore muscles, seaweed doesn't shout, it soothes. 5. Green tea, the anti-inflammatory river flowing through you. If seaweed is the mineral blanket, then green tea is the river that flows through it all. For Dr. Hinohara, green tea wasn't just a drink, it was a ritual, a daily rhythm that connected him to stillness, clarity, and healing. But modern science now confirms what centuries of tradition have whispered. Green tea may be one of the most powerful anti-inflammatory drinks on Earth. Here's why. Green tea contains catechins, particularly E, G, CG, a compound shown to inhibit NF-κB, a master switch for inflammation in the body. NF-κB acts like a fire alarm. It tells your immune system to react, even when there's no real danger. And after 60, this alarm tends to get stuck on. That's why so many seniors feel inflamed, achy, or foggy, even when nothing specific seems wrong. But catechins turn down that alarm. They restore a calmer baseline inside your blood vessels, brain tissue, and joints. One 2022 meta-analysis found that adults who drank 3 cups of green tea per day had a 21% lower risk of all-cause mortality, especially in older populations. But the benefits aren't just physical. Green tea rituals help lower cortisol, soothe digestion, and increase alpha brainwaves, the same ones activated during meditation. So, what's the ideal rhythm? Enjoy 1 to 3 cups daily, preferably between meals, and avoid sweeteners to preserve the full effect of the catechins. Matcha, sencha, or simple steeped green tea bags all work. The key is consistency, not perfection. Elaine, 67, used to rely on soda for her afternoon energy crash. She swapped it for warm green tea with a slice of lemon. Within 2 weeks, she said, "My joints stopped complaining, and my mind felt smoother, like my thoughts had more space." Green tea doesn't just hydrate, it heals in motion, like a river clearing yesterday's weight. What if healing didn't begin with fighting? What if it started with feeding something quiet? A spoonful of fermented beans, a bowl of soup, a sip of something warm and green. That was Dr. Hinohara's rhythm. He didn't chase youth. He nourished longevity, gently, daily, without noise. So, as you sit with these 5 foods, maybe the question isn't, will this reverse inflammation? Maybe it's, what does my body quietly need right now? Because after 60, healing doesn't always come through struggle. It often comes through softness, through simplicity, through care. Which of these 5 foods feels most doable for you this week? Natto, miso soup, seaweed with rice? Let us know in the comments. Your answer might encourage someone else to begin. And if this video helped you feel a little more hopeful, a little more curious about aging well, consider subscribing. This channel is here to walk beside you with tools, warmth, and wisdom every single week. Until next time, stay gentle with your body. And remember, sometimes the most powerful medicine doesn't come with a label. It comes with a meal.